So far, my conversations surrounding Black Lives Matter and diversity and inclusion have been with leaders inside GE. But now I'm going to talk to the COO of the only dedicated heart hospital in New Mexico to get a better understanding of his experiences and his perspectives when it comes to race and diversity in the healthcare industry.
Denzil, your resume speaks for itself. You've got a significant amount of time inside the healthcare industry. You've been recognized by your local business journal as a 40 under 40, and you're now the COO of a dedicated heart hospital in New Mexico that has over 260 individual beds. That's an impressive resume. But what for you, Denzil, has been the highlights of your career so far?
Well, first off, thank you for having me. And I want to say thank you to GE for using their platform to have this conversation. I think especially what has been going on in our country today, I think this conversation is such an important conversation to have. So I applaud GE for using their platform to do so. To answer your question, I would say one of the biggest accomplishments or as you stated, to date would be I won an award when after recently graduating from college. The university that I went to, Park University in Parkville, Missouri, had a Young Professional Award. And as part of that award ceremony and the interview with that, I told the reporter that one of my plans or one of my goals after graduating college was to become a hospital executive before I turned 35. And I could say, I think coupled with being blessed, being in the right place at the right time and meeting the right people, and of course, being prepared for that opportunity, I was able to become a hospital executive at the age of 32. And so there are not a lot of hospital executives at my age in the industry. And so I feel very proud and blessed to be able to have met that goal.
Black Lives Matter has been re-energized by the death of or the killing of George Floyd. What does this re-energizing of this movement that asks for social justice, that asks for equality for Black men and women, not just in America, but across the world, what does that mean to you personally, and how do you apply that within your role?
Well, first, let me state this, that do I believe all lives matter? Yes, I do. But I think now at this time, the ability to say the words Black Lives Matter means something. It does not mean that Black lives matter more. It does not mean that all other lives do not matter. So I think it's very important, and how it relates to me and my environment, if you will. Healthcare is not necessarily a diverse industry. And I think there are a number of different reasons for that. Very often, I am the only one of color in a room, or maybe one of two, one of three, but definitely the minority in a percentage or in pure numbers as it relates to my involvement in whether it be work, whether it be my circle, primarily just because of the nature of what I do.
Denzil, why is the healthcare industry not diverse? Why is it so overwhelmingly white inside the healthcare industry?
There are a number of different reasons. Number one, I think education plays a big part of this. So just off the bat, you look at the pure numbers of people of color graduating, people of color entering into college after high school. You look at the access to education as it relates to the type of education that you may get in one zip code compared to the other. And I think so that's a huge challenge. I think a big part of it is the cost of medical school. You find a lot of people, they don't know how to even start in terms of saying the amount of money that it costs for medical school, depending on what's part of the country and what's the name of the school that you're going to. You're looking at $300,000, $400,000, $500,000 over the lifespan of your time. Again, dependent on your specialty or modality that you're going into. If it's primary care versus specializing in surgery, you're looking at an additional 5 to 8 years after medical school and residency of training, and the cost involved in all of that, I think it's insurmountable. I think that's why we see a shortage in physician coverage across the country today. And another reason why you see a lot of international physicians in this country working, because I think they have to step in to kind of supplement that need.
I'm very fascinated by the Hippocratic Oath that doctors take. The Hippocratic Oath being to care for all people and respect the sanctity of human life, regardless of their identity. Does it actually work in practice, or does it have its fault lines?
I definitely think it has its fault lines. Is it the majority? No. It's definitely the minority, but it's definitely there. I think that it's there for a number of different reasons. It could be because of upbringing. It could be because of what part of the country you were born. It could be in what time frame of this nation's history that you either were born or you got into medicine at that time. I definitely think that most people go into the field wanting to do good, but there's some implicit bias that hangs around primarily because of our life experiences. My daughter, I have 2 daughters, 2 beautiful little girls, Sydney and Bailey, 5 and 18 months. And at one point in time, there was a little bit of an outbreak in the daycare for hand, foot, and mouth. And we tried hard my wife is not the pediatrician for her kids, because in some cases, I still like her to be mom and not be the doctor, right? And so we took her to the doctor, only to realize after that she was misdiagnosed of not having hand, foot, and mouth. My wife knew better. We sought a second opinion, and sure enough, she did have hand, foot, and mouth. And I couldn't understand why until my wife pointed out something to me. Hand, foot, and mouth, or lesions on the skin, look very different on a white person as they would on a black person, a person of darker skin. You look at all the textbooks in medical school, they very seldom show what the lesions look like on a black person compared to how it looks on a white person. So from that standpoint, you could see there's some disparity there, primarily of how the education is set up and how the education is laid out to those people in medical school or in residency.
Denzil, has there ever been an occasion where a white patient or the family of a white patient, if the patient was incapacitated, has objected to being treated by a black clinician or a black doctor?
I have heard of times where patients or their families have objected to the person who has been appointed over their care, primarily because of race. And there was no method behind their thought process in terms of why they wanted that happen. I've seen it going both ways, where the hospital has been able to make that request happen, and some cases where they've had to say, this is the doctor on duty today, and so it's your choice whether you want to receive care or not, but we're not able to make that a request happen today.
What do you say to a white male in terms of someone that really wants to contribute and support the movement, but doesn't quite understand the entirety of what you're going through simply because of the color of my skin, and that's not something that I face?
Don't be afraid to have the awkward conversation. You need to have the awkward conversation, and I think it starts with asking why. Asking why, but also then being open to listening. You're right. There's in a lot of cases, there's so much that I could share to your response, to where your response could be, sure, I understand. Because in a lot of cases, you can't understand unless you've walked that walk or walk in my shoes and experience some of the experiences that I have gone through, or that person that you're talking to at the time. And so I think it starts with being open to having that awkward conversation. Part of that awkward conversation is being open to listen and learn and understand that we see life through very different lens. I often say that, we both could have the same title. We both could dress the same way. We both could drive the same car. We both could live in the same neighborhood. But my drive home could be very different to yours, purely because of the color of my skin. And we see that today.
Denzil, thank you so much.
Thank you for your time today.
Take care. All the best.